I had my formal hematology training at Mount Sinai, Manhattan. After that, I went to Memorial Sloan Kettering Cancer Center, where I received my formal oncology training, medical oncology training. I then joined the staff at Mount Sinai, Manhattan as a full attending. And when I came out to Queens, I realized there was a great number of patients who needed oncological care. The patient population in the area were rather elderly, did not want to travel into Manhattan, and I felt kind of bad that the great quality of care that was being delivered at Mount Sinai, Manhattan, couldn't be given in Queens. Fortunately, in March of 2012, I was appointed director of a new unit, the Mount Sinai Queens Infusion Center, and with the help of two other very capable doctors, one who is a general oncologist but also specializes in urological cancer, and another who specializes in breast cancer, I was able to deliver the same excellent care available in Manhattan in Queens. Although Mount Sinai Queens is a community hospital, it's more than that. It's a community hospital, has the resources of a large hospital, thanks to the collaboration with Mount Sinai Manhattan. And since the center opened in March of 2012, we've been able to give infusions to hundreds of patients and basically deliver the same care available to those who go to our main hospital in Manhattan. The great part of the work I do, however, is in the field of medical oncology. I specify medical oncology because there's now multiple disciplines such as surgical oncology and radiation oncology, which deals with the same patient, but I do it from the aspect of systemic therapy. The oncologist really deals with diagnosing and treating cancer. My particular area would fall into general oncology. I don't tend to pick out just one tumor over all the others, or there are some doctors who see just breast cancer or colon cancer. I basically see all what we call solid tumors. And solid tumors consist primarily of lung cancer, breast cancer, colon cancer, and prostate, and various other cancers that are not seen as frequently. My job basically is, again, to diagnose, and then after the patient is diagnosed, to work with other doctors to figure out the best way of bringing about either cure or at least long-term palliation where the patient is comfortable and lives as long as possible. And one of the ways we do that is through our collaboration here, where we have on the premises many talented surgeons and radiation oncologists. That, together with multidisciplinary meetings and tumor boards and the help of our electronic health record system, EPIC, we can collaborate on a very high level, all for the benefit of the patient. One of my most memorable cases is this fellow who came to me distraught because he was just diagnosed with acute leukemia. I looked at the type of leukemia he had, and I sort of had to agree with him. It didn't look very promising, his prognosis. And generally, we see, at the best of circumstances, a survival a year, up to 2 years maybe. And he wanted to start a family. He had just gotten married. We treated him at Mount Sinai, and lo and behold, he still sees me every year now, and it's 25 years. Every Christmas brings me a gift, thanks me, actually embarrassed me sometimes. He's European, kisses my hand. And I had said to him most recently, I said, look, you got to stop giving me gifts like this. Number one, I can't accept these gifts. They're very extravagant. I don't drink that much. I says, but if you want to get me something, you want to know what I like pastrami sandwiches. So I sort of humored him that way. A week later, he walks in with several large bags, pastrami sandwiches for the whole staff. Well, needless to say, I was eating pastrami for 3 days. My blood pressure went up a little bit, but it made him very happy, and it's one of the great cases. And I'm glad to say he's not the only one. I have quite a few cases like him, very long-term survivors who are very grateful. And actually, that's, quite frankly, is the thing that keeps me going. My son, who's also an oncologist, at first said, Dad, how can you do this? This is, so depressing. I mean, how can anyone go into a field like this? I said, Dave, you're going to be the only hope for an individual, and you're going to save their lives, or at least make their lives substantially better. And if you got just one person, or multiply that times 10, 20, 30 in the course of a practice, it's worth it.